And there you go. And can you let me know if the screen share is showing?
Yes.
Yes.
Perfect. Hello, everybody. My name is Stephanie Pelletier with the Austin LGBT Chamber here in Austin, Texas. We are happy today to be helping host this webinar with Michael Lopez at Austin Oaks Hospital. Michael, would you like to tell us a little bit about your hospital there?
Yes, of course. Good morning or afternoon, everyone. My name is Michael Lopez. I am a representative here with Austin Oaks Hospital. For those of you all that aren't familiar, Austin Oaks is an acute care psychiatric facility. We are located in South Austin, right off of Stastny and Menchaca. And we offer crisis stabilization for clients ages 4 and up. So we serve children, adolescents, adults, and we also have an exclusive women's unit. So one thing that we really pride ourselves on in letting the community know is that we are open 24 hours a day, 7 days a week, and we offer a free level of care assessment. So if any of your clients or loved ones or any sort of psychiatric emergency, we are here to help in any way. We offer both inpatient as well as outpatient services. So it's good to kind of have that resource if and when the time comes. And we are very excited to be here, especially during this time of the world is a lot of the unknown with the COVID-19. And so we have, I'm happy to welcome our Director of Clinical Services, Molly Wang, who will be offering this CEU credit today. So I will transfer it over and get Molly on board for you all. It'll be just a quick second.
Thank you, Michael. Thank you to everyone who is getting their CEU credits. I'll be sending your email addresses to Michael at the end of this. And then anyone you know who's wanting to get the same credit, you're welcome to send the video to.
Hi, everyone. Good afternoon. I'm Molly Wong, and I'm the Director of Clinical Services at Austin Oaks Hospital. Thanks so much for having me. My role is over our women's, adult, children, and teen inpatient programs. And I oversee a really dedicated compassionate team of therapists and case managers, and we're all at work today serving the people that we serve here. And so everyone is not without their anxieties related to COVID right now, which I'll talk about later in this presentation. So it's really nice to meet everyone. I want to start out by telling y'all why I chose this topic. So I chose this topic because every time I read the news, I see and read a lot about the physical impact of COVID. So things like how many people have passed away, how many people are hospitalized, as well as changes to state and city ordinances. But I'm not seeing a lot about the psychological or mental health impact of COVID. And when I presented on this topic back in May, there was virtually no coverage on the mental health aspect. And now I'm actually seeing more and more. So I'm really happy to see that more people are talking about this because it is just as important. And so I want to focus on 3 things during this presentation. Try to move forward here. There are 3 main takeaways I would like to focus on. The first one is after this presentation, you should be able to explain the effects of COVID-19 from a trauma-informed lens, and I'll talk about what that means. You should be able to recognize factors that make certain individuals and communities more at risk, more vulnerable of developing COVID-19 related psychological trauma, and describe strategies for individual and community healing and resilience. And so you should be able to walk away with some strategies on how to cope on your own on an individual level, as well as on a community level. And while I know that COVID is stressful for everyone, the reason why I want to focus on some risk factors is because there are certain characteristics that make some people more vulnerable than others. So there are so many definitions of trauma out there, psychological trauma out there. So I decided that my favorite one is the one from the American Psychological Association. And that defines trauma as the result, as an emotional response to a distressing event, such as a threat. So just like how physical trauma can cause physical damage to your body, psychological or emotional trauma can cause damage to the mind. And so psychological trauma, for those of you who are not healthcare providers, because that's usually my primary audience, I'm more accustomed to presenting to healthcare providers. For those of you who've never heard this term before, it's a concept that is often used in the fields of social work, counseling, psychology, and psychiatry. And so trauma, psychological trauma, is the result of an overwhelming amount of stress that exceeds one's ability to cope or integrate the emotions involved with that experience. And so what are the impacts of trauma, you might be thinking? Well, short-term impacts, and then there's long-term impacts. And so our short-term impacts are things like shock and denial. So I can't believe this is happening. This can't be happening. Long-term reactions are unpredictable emotions. They might be flashbacks, relationship dysfunction, physical symptoms such as headaches and nausea and depression. And so researchers have noted that both long-term and short-term reactions are actually very normal reactions to distressing events. They're actually very almost like rational responses. Like, who wouldn't react that way, right? But if they're not managed properly and kindly, then some people will have difficulty moving beyond those reactions and moving on with their lives. So they'll be very stuck. And that's when we mental health providers become concerned. So researchers in this field have observed three main reactions to trauma. And the first reaction is fight. So there's fight, flight, and freeze, which you all may be familiar with, but I'll talk a little bit about fight first. So fight responses, when researchers observe individuals who have fight responses, they'll observe things like crying, desire to punch, rip, stomp, kick, you know, like those fight feelings and behaviors, a lot of feelings of rage and anger, grinding teeth, flex jaw. But when you think about how fight responses might look like in our society to COVID, and what that might look like on the news, you might see things like protests of all varieties. Nurses and healthcare providers protesting against the inadequate supply of PPEs. You might have people who are protesting against wearing masks in the first place. A lot of those responses are fight responses. And then you have flight responses. And so flight responses are characterized by physical signs such as restless legs and feet. You might notice that somebody has shallow breathing. They're always looking around, they're darting their eyes. And many of them might report a sense of running in life from one activity to the next. And if you look at the people that you know or on the news, some examples of flight responses might be excessive shopping for supplies. A lot of individuals who are really afraid that their situations may be compromised by lack of supplies. They might go through a store and buy everything and save nothing for somebody else. That sense of anxiety is what's driving that in the background. You might have teens. A lot of parents have reported to me, all my teen does all day long is play video games all day long as a way to escape, to fly away. And then for other people, it might be excessive exercise or even something like substance abuse to escape from the reality of what's happening. And so the next is a response that happens often to many people when their flight or fight response is active for too long, and the threat is still ongoing. Because for COVID, right, a lot of people will fight and flight for the first couple of months, and then they'll realize that COVID isn't going away. It's here to stay for at least a while. And what happens is that when their system is in flight or fight for too long, then they might fall into a state of freeze. So when it comes to a freeze response, and I actually see freeze responses more and more in many of the patients that are here at Austin Oaks. Many people will fall into a deep depression. They'll literally freeze. Their bodily functions will actually slow down. They'll be consumed with feelings of hopelessness, thoughts of suicide. They might swing between feeling numb and totally devastated. They might fluctuate between feeling apathetic and inconsolable. Many patients that I've been seeing in really the last 2 weeks are reporting to me that before their hospitalization, they spent about 3 weeks in bed. They avoided talking to their friends. They turned to alcohol and food for comfort. They're basically using, they're frozen in time almost. They can't move on. And so as a healthcare provider and as a hospital director, I think about COVID every day, not just because it affects me personally and my team, but it's really been a challenge for us as a team as far as what can we do differently than what we have been doing before COVID to help people move forward in this situation that is so uncertain, and how do we help them find hope? And how do we keep ourselves hopeful as well? Because people can sense when their healthcare provider is losing hope. And so those are the 3 main responses. And I want y'all to kind of think about in your own lives, whether or not they've come up, whether or not you've seen them come up in people that you know. I sometimes find that by being able to classify things and responses and give a name to different types of responses, I find comfort in that. So I have a question for you all, and feel free to use the question answer option at the bottom of your screen to share your responses, but only share what you feel comfortable with other people seeing. But I'm very interested in hearing from you as far as in what ways do you experience and perceive COVID as a threat in your lives? So take a moment and share a couple of answers to that question, if you feel comfortable. If you don't, feel free to jot down in your journal or on a piece of paper how you, and if you do experience COVID as a threat to your lives. As you can see here, I included a picture of nurses protesting against for better PPEs. I really love this picture because the sign is all the more true, especially right now. So let's see here if I got any responses. Okay, so I haven't gotten any responses, and that's totally okay. That means that people are writing down their answers. Oh, here, I have one right now. Okay, yeah, this makes a lot of sense. Thank you for sharing that. Yeah. I've been seeing a lot of parents who have told me that they're worried about their kids' development. So I have friends who just gave birth to friends who kids just finished preschool and have not been able to start kindergarten. And they're very threatened by the idea of their kids not developing like they would in what they call the old world before COVID, because it is kind of like an old world and a new world, right? Yeah. Okay, I see another really great response. Well, thank you so much for sharing. I'm going to move forward. Yeah. Oh, this person shared something that I'll respond to because I definitely can relate to this. So this person shared that they fear that they could endanger someone they love without knowing they're infected. That is a fear that I live with every day. Even though we are a psychiatric hospital and we're taking some pretty extreme precautions against COVID, and we're not the ER. But we do serve some individuals who are experiencing homelessness, and we do have kids who, kids can be very, they're like germ bombs. So I'm always afraid of what I might bring home to my partner, as well as my parents who, don't live with me, but, have see me from time to time. So that is definitely something that I think about every day, and I'm glad that there are people out there who can identify with that. Okay. So I want to take a second and talk about why it is important for me to use a trauma-informed lens to talk about COVID. It's because it's so easy, right, to judge people based on their responses to COVID. When I first saw news coverage about folks that want to, what's the motto? They want to don the flag and ditch the mask. As a healthcare provider, I had a very visceral reaction to that. I thought to myself, that's ridiculous. Why would these people want to forgo the mask? It saves lives. But then I caught myself and I thought to myself, everyone deals with trauma in a different way. Even though I disagree personally with how they're responding to the mask ordinance, I am also dealing with trauma. So the universality of where I'm coming from and is the same place as where they're coming from. So I definitely think it's important to use that trauma-informed lens because you can respond to people's reactions with more compassion and understanding and less judgment. And then, the next step is to figure out how to move forward together because we're all in this together, right? And so another reason why it's important to look at COVID from a trauma-informed lens is because COVID is a type of trauma. COVID is a distressing threat that can lead to a state of hyperarousal, anxiety, and stress, and eventually the freeze response, depression. COVID is a traumatic threat because it's uncertain. We don't know how long it's going to be with us. Back in March, people said that it's going to be with us for 6 months, no more than that. Now I'm hearing even the World Health Organization is saying they don't know how long. And so that's very difficult because you can't really plan around uncertainty, but yet we have to. For a lot of people, COVID, actually for almost everyone I know, to some extent, COVID has resulted in a loss of relationships, supports, and freedoms. So we fall into a panic because we become destabilized, right? Whenever we lose things in our lives that give our lives meaning and stability, like work and our social lives. And without those things, it's easy to panic. And for some of us, COVID can pose an existential threat, causing a crisis of identity for some. And I can talk about that in a little bit. And so, most important thing that I'm going to talk about later is for a lot of communities, one of the biggest reasons why COVID is a traumatic threat is because it actually threatens their economic livelihood. And so I'm going to talk about risk factors. This is not an exhaustive list of risk factors, but these are risk factors that have been documented and well researched recently. So I thought it would be important to focus on them. And like I mentioned before, COVID is stressful for everyone, but there are certain characteristics that make some individuals and communities more vulnerable. And so these individuals and communities may experience the various ways COVID is a threat more severely, more repeatedly, more concurrently, and that can lead to a buildup of stress and anxiety that overwhelms their ability to cope and process the effects. And so here we have healthcare providers. That's definitely a community that is particularly vulnerable to the effects of COVID. And then you have individuals with mental illness, older adults, and racial, ethnic, sexual, and gender minority groups. So let's talk about healthcare providers. For many of us who are healthcare providers, we will experience a crisis of identity. And that is a result of something called moral injury. And I don't know if everyone here is familiar with that concept, but basically moral injury is a deep wound to our conscious or moral code that results from committing, failing to prevent, or witnessing acts that go against our beliefs, values, or code of ethics. So it's a concept that's pretty well known to individuals who worked with military trauma. And so in war, for instance, moral injury can occur after hurting a child in the line of fire, or after failing to report an assault for a fear of retaliation. So it's like an injury to our sense of ourself as a moral being, like who you are, who your values are, what your values are, and what your morals are. So in terms of COVID, on the front lines of a pandemic, it can be, moral injury can be something like having to follow poorly communicated COVID safety procedures while running out of time to resuscitate a patient, for instance, while at the same time doing all of that in the absence of protective gear. So some doctors in New York, for instance, have to face the impossible choice of denying care to somebody's grandfather in order to save someone's mother because of lack of resources. And as parts of our healthcare system, that's bravely failing to ensure that care is available to all its citizens. And so in New York, there was a doctor, Dr. Lorna Brain, who, this was in the news not 3 weeks ago. That's just a screenshot. This is back in March. She died by suicide. She took her own life because she was experiencing a significant level of moral injury. And she could not, I think she was impacted significantly by trauma that she had a very difficult time. It exceeded her ability to cope with everything that was going on. And so I included a quote here by Arthur Markman, who is professor of psychology at our local UT Austin. And he said that few people in healthcare have had real life experience with triage in which significant number of life and death decisions had to be made because of equipment shortages. That increases the chances that they may experience moral injury as a result of their jobs. So healthcare providers also have to work sometimes 12 to 16-hour shifts with a few breaks between. I'm referring mainly to ER doctors and healthcare providers, and compared to, for instance, military or police who are required to, take a break between deployment or shifts. Healthcare providers sometimes work multiple shifts in a row. And so that also wears them down and makes them far more vulnerable to the trauma that's related to COVID. And so the second risk factor is having a mental illness. And this is something that I see every day here in Austin Oaks. COVID-19 can activate and aggravate mental illness in individuals who are already diagnosed, especially diagnosed with major depression or bipolar disorder or schizophrenia, because those types of mental illnesses rely, the success of treating and maintaining a healthy recovery, if you have one of those diagnoses, depends significantly on structure. And with COVID, a lot of our rituals and structures have fallen apart, which makes it harder for individuals to maintain the recovery. So things like social distancing can increase isolation from social supports, disrupting things like your routine, continuity of healthcare services. And that means clients may miss opportunities for timely intervention. And so what I've seen here is we have individuals who are following up with outpatient care consistently, and things are going very well for them, but their outpatient provider closed their office and everything went to telemed. And what happens is telemed is far more accessible for some, but far less accessible for some, right? And so they might miss an appointment. They're not used to that as a mode either of healthcare. And then they'll miss refilling their medications, or that sometimes people just really rely on that face-to-face connection. And so as a result, they run off their medications, and then they come here in Austin Oaks because a kind neighbor called for help, called us or urged them to get help, or called the police, and the police brought them here on emergency detention. And so a lot of the cases that I've been seeing recently because of COVID, they're preventable. If COVID wasn't around, then I know that these individuals wouldn't be back. And then also mental health crises such as psychosis or suicidal ideation, they can often be delayed if people are social distancing, and the home healthcare provider that usually comes to your home that picks up on, how well your grandma's doing or how well your mom is doing, may not pick up on that until it's too late. Older adults is definitely a risk factor. The slowing down of community life can lead to increased isolation and loneliness in a population that is already pretty isolated. And for older adults who are living independently, social distancing can increase isolation from social supports. So I am afraid to see my parents because I'm afraid that I might infect them, whereas I may be asymptomatic, but they might be infected. They might be isolated from not only the social supports, but also it's an interruption in their routine, right? One of the services that I know was suspended for a while was on wheels, and that was the only social interaction that one of our patients was getting before it was suspended. So not only did she have food delivered to her house, but when the delivery person brought their food, they also chatted and visited with them, and that social stimulation was very helpful to that person's mental health. And then also a lot of older adults, especially those who live in nursing homes or those who may have seen their friends pass away in nursing homes, they have reported feelings of just being discarded by society. And that can definitely intensify whatever existing mental health issues or depression they're experiencing at the time. And so the fourth risk factor is simply being a member of a minority group. And so minority groups in the United States, such as African American, Hispanic, Latino, LGBTQ, and as well as Asian American communities, they already face health inequities, right? And so COVID actually exacerbates existing health inequities and exacerbates minority stress. And so minority stress is a term that's used to describe stress that is experienced by individuals who have a minority identity. And the stress primarily comes from lack of access, inequity, and also individual and social discrimination. So it's something that the person lives with every day. They might look like microaggressions, or they might look like systemic racism. And so for a lot of minority communities, they are disproportionately impacted on multiple levels, individual discrimination as well as economic discrimination from COVID. And in terms of the shelter-in-place restrictions, we have heard some African American and Hispanic Latino older adults here in Austin Oaks share that when the shelter-in-place was first enacted, it actually reactivated their trauma from having lived through segregation. Even though it's not the same thing, but they told me it was like back in the day when I couldn't go somewhere. They told us that we couldn't go to places. So it was a reminder of that for them. And some of them reported to me that some of that old trauma was reactivated. So I included a quote here by the Surgeon General of California. Her name is Nadine Burke-Harris, about the impact of COVID on the African American community. And I thought she summarized the impact very well when she said that when referring to the African American community, she said the science is clear, stress can accumulate in our bodies, it gets under our skin and changes our biology. And then for African American, that means we're at greater risk of asthma, heart disease, and diabetes, risk factors that have far worse outcomes for African Americans if we contract the coronavirus. And so as far as the LGBTQ communities, and I'm very glad I have this opportunity to share some of this information because the Chamber of Commerce, I'm sure that you guys serve a lot of businesses and especially small business owners, and I really wonder how they're reacting to this. But for many LGBT individuals, the new stressors that they're facing are loss of work and income from the shelter in place and from the economic downturn. In a study by I believe this information is from the article published by the Harvard Business Review. It was reported that LGBTQ individuals are more likely to experience food or housing insecurity as a result of working in retail and service industries. And then another stressor are school closures. Many individuals who were out in school and among their friends now have to live at home with their family of origin, who are not always very accepting. And they have to hide their identities at home, and many of them may even have to find another place to live if they want to be out at home. Then you have even more reduced access to care. So transgender and non-binary people face barriers accessing gender-affirming care because hormones and surgeries may not be considered essential, right? Even though they're essential to their mental health, but they're regarded as non-essential in the healthcare system, so they can't access those things. As well as some same-sex couples might want fertility treatments, which are now not considered an essential service either, so they can't access that in order to build their families. And then you have reduced access to legal protections. I'm not sure if in the state of Texas, family courts are still closed, but some families may lose access to critical legal protections related to co-parent adoption while family courts are closed. So a lot of the things that people rely on to have a quality of life are disrupted or harder to access or just not available at all. Okay, so now that we've talked a lot about risk factors, let's talk about individual and community healing. So what do we do with all this information? And it's all very scary. Is there anything that we can do about it that's beyond hand hygiene and sheltering, right? And that's another thing on the news is that there's a lot of tips on, you know, how do you prevent yourself from contracting COVID so you don't get sick, but there's not a lot of information about how do you keep yourself psychologically healthy from COVID. Like I know I'm supposed to wash my hands 20 times a day. I know I'm supposed to stay in my house, but that's obviously not working out for everyone. That's not enough information. And so part of the goal of this presentation is to share some best practices so that we can not just survive, but also thrive. So one of the most important things that you can do to stay psychologically healthy and resilient is to create new routines where you can practice healthy behaviors and set a mindful intent when it comes to things like sleep, exercise, nutrition, and media use. So in some Chinese studies that I reviewed on how to do this, it's recommended that you get a little bit more sleep if you can during this time. So In a recent China study on individuals who are impacted by COVID, individuals who sleep less than 6 hours were actually at an increased risk for PTSD. And I know that this is actually pretty consistent with existing research on sleep, even not during COVID times, but basically sleep is a very powerful tool that I know it's, you know, common sense, but I don't think that we all set in mindful intent to make sure that we do this. Getting adequate regular sleep also helps regulate your circadian rhythm. So for a lot of us who might be furloughed or working from home, our schedules are just not as structured as they were normally, right? That they were before. And so it's really easy to do things like, and I'm just referring to my, you know, my own social network. My friends have told me that they're going to bed every day at 2 a.m. Whereas they used to go to bed at 11 p.m., but they don't have to go into work anymore the next day. They're working from home, so there's not that commute. So they're going to bed at 2 a.m. and they're waking up, you know, right before they have to get on their Zoom call with their boss at 8:30. They no longer have that waking up routine that they used to set in the morning before they got in their car. And they kind of underestimated the helpfulness of those routines. So I reminded them that if you establish a regular sleep schedule, your circadian rhythm is going to be regulated better, and then you can approach your day with more intent and a healthier mindset. And then as far as exercise, find ways to exercise. I know that gyms are closed and that you have to be careful if you're exercising outside, but even 15-minute jump rope inside your house, if that's something you can do, or yoga, or a quick stroll around your neighborhood can make a world of difference. And then make sure that you're eating well. Stress makes us seek comfort foods, high in carbs and sugars, which can impact our mood. So really making sure that you're planning your grocery shopping around a mindful diet. And then media use, social media use. Daily social media use around the world. So it's global internet users amounts to over 2 hours per day. And research shows that is too much. So especially right before bedtime, the recommendation is to avoid reading COVID-related news before bedtime. I am guilty of reading the news before bedtime, but I try not to look at COVID-related news. I try to scroll through the Reddit section where I look at cute pictures of kittens or something like that. Watching or scrolling through social media can sometimes make us even more anxious. If you look at excessive news and images about a traumatic event, it can actually have an impact on your mental health many years later. And so on the right here, you'll notice that I included a picture of a quarantine routine. This is not my routine. This is one that my friend sent me. She's very lucky. Her routine is very, very chill. I told her that my routine is a lot busier than that because I have to go to work every day. But she's somebody who doesn't have to right now. She's been furloughed. And so she makes sure that even though she has a lot of time, that she uses it mindfully. And I think that if you don't have a new routine, if your old routine is no longer existent and you need to establish a new routine, I think it's helpful to write it down and to make sure that you're following a schedule. So at the psychiatric hospital over here, we have schedules posted on every unit that start with wake up time and end with bedtime. And we hour by hour lay out on the schedule what the activities are that take place. And that's because we want our patients to know what to expect, because predictability and a structured schedule are vehicles for healing. And if they can have, if many of them have very unpredictable, tumultuous lives. So if they can see what to expect and live by the schedule, then they will be able to manage their symptoms and recovery better. And so what we encourage them to do is to create a schedule before they leave the hospital, before they discharge. that looks similar maybe to the schedule that they follow at the hospital, or any schedule that has a very clear wake up time, you know, and time to reflect and time to exercise and time to think, everything that you need to have like a healthy mind platter, so that they can start doing that at home. And the second thing that you can do is to tune into your thoughts and how they might affect your feelings and actions. And while you're doing that, accepting what you can and cannot change. And so our thoughts often control our feelings, our perceptions, and our interpretation of the world, and our interpretation of the state of the pandemic. And so I really like this graphic, and I use this often in group therapy with teens and littles. It's called, so it's a little fox, although I've seen these with different animals, but the little fox has an understanding of what he can control, and he'll only focus on those things, and then what he cannot control, and he'll let those things go. And I have teens and littles make their own drawing with their own spirit animal guide, or whatever they want to call it. Sometimes they draw themselves, and then they write down things that they can focus on. Excuse me. And then they write down things that they can't focus on. And then I asked them, how many of those things were part of the reasons why you were here at the hospital? And then many of them will realize that a lot of the things that are things that they should let go, they're kind of outside their sphere of influence, are things that really drove their admission to the hospital. And so this is just an exercise that I encourage everyone to do maybe once a week, you know, making this graphic, and then later revisiting it, as well as adding to it, because you'll realize that there are a lot of things that you can't control that you become very fixated on. Let's see here. Then I will show you some examples of thought distortions. And so we do a lot of CBT, or what we call cognitive behavioral therapy at the hospital, which is a type of therapy that's evidence-based and effective. And it's about identifying thought distortions. So thought distortions are another way of referring to them, or there's unhelpful thinking styles. Sometimes when we're thinking, we might fall into these thinking traps or unhelpful thinking styles. And these are some examples of thinking styles that are unhelpful, or cognitive distortions or thought distortions that we talk about a lot in CBT. And so when we're living during COVID, it's easier, I think, to have thought distortions because it's a very stressful time and we're all very threatened by everything that's going on. That sometimes, you know, it might be helpful to stop and think, am I magnifying the severity of the situation? Am I catastrophizing what's going on? Am I blowing things out of proportion? And then sometimes what we might do is we might use a mental filter. I see this a lot, where when you're in a state of freeze and you're very depressed, it's very easy to only pay attention to certain types of things, such as your failures. And so it's important to kind of take a step back and recognize that that's a thought distortion, and that you're only paying attention to certain types of evidence, and you're only noticing your failures but not seeing your successes. And especially during this time, it's really important to try to avoid all or nothing thinking, or sometimes it's called black and white thinking. So some people who have lost their jobs during this time think that it's their fault. But then they take a step back and realize that a lot of people have been furloughed, and it's more the big picture than it is about them as an individual. So I think all of us have been guilty at one point or another of some of these thought distortions. And so if we could take a step back and just kind of recognize that our brains can play tricks on us, it can help us manage some of our COVID-related trauma and anxiety better, and so that we can be more resilient. Okay, so the last thing I want to talk about is to make sure that you're giving yourself enough time to grieve and that you're allowing yourself to grieve. So grief is the pain of loss and the human process of metabolizing and accommodating loss in our lives. And so the current pandemic is bringing us loss at scales that we've never known before. Many of us have lost people that we know. We've lost friends or family, people all over the world that we don't know. We've lost other things too. There are not people. We've lost access to school, to our social lives. We've lost access to predictability and certainty. Some of our losses are postponed or delayed. So some of them are canceled or lost forever. I know people who have postponed weddings, postponed the birth of another child. They can't attend, their loved one's funeral. They've had to put a lot of things on hold. And there is a concept in the research around loss and grief called ambiguous loss. And it's really important to point out this type of loss because it's very different from other types of loss. With for lack of a better word, normal type of loss, something happens that's very painful. You grieve, you go through the stages of grief, and you move forward, right? But with ambiguous loss, it's a loss that occurs without closure or clear understanding. And this type of loss can leave the person searching for answers and complicates and delays the process of grieving. And I think COVID causes, for many people, a certain degree of ambiguous loss, because those things like birthdays and weddings and other rituals, it's not like they're totally lost forever. You might still access them again at one day, but you don't know when. And so you can't really have the full type of closure that you would if it's definitively someone passing away. I've been reading personally a lot about the research around ambiguous loss. And so this is coined by Dr. Pauline Boss. And she came up with this concept when she was working with parents who have missing children and individuals who have a parent who they lost to Alzheimer's, or kids with parents who are incarcerated. And so all of those have one thing in common, right? Where the person or thing that they lost is still kind of there, but it's not. And so I found it very healing to be able to put a label on this type of feeling that we're going through as a society, because it's not as though you are going to lose your social life forever, but you don't really know when you're going to get it back. So you still have to mourn that to a certain extent. And just as a reminder, there's no right way to grieve. This is a process that each of us must go through, and we just have to find a way to integrate the loss into our lives. And so as far as community healing, even though you can heal as an individual, I think because this pandemic is something that affects us as a society, long-term healing can only be achieved collectively. And it's not enough to cope on an individual level either, because healing overall is collective. So it's important to do things like taking action and advocating for systemic change. In terms of things that are impacting a lot of us, like, shortage of PPEs or this economic downfall, all of us can talk to our government representatives. We're in a crisis right now, but once the dust settles, those of us who remain can come together as a community and demand systemic change. And then also organizing for something bigger than ourselves can be very motivating, energizing, and reduces overall isolation. And so use Zoom, use your phone, use social media, responsibly, but don't forget that healing and resilience has to be at a collective level as well. And so that's all I have for y'all today. I know that was a lot of information. Feel free to connect with me on LinkedIn. I'll ask Michael to send out a copy of this presentation if you're interested in reviewing it. I have some references at the end as well if you want to look at that later. But it was really a pleasure to share this information with y'all, and I really hope that we can continue to think about the impact of COVID on mental health, because it's not talked about enough. Yeah.
Thank you so much, Molly. This is Stephanie again with the Austin LGBT Chamber. That was awesome. It's really good to dive in, especially a lot of that's PTSD related. And I think it's super helpful right now. I'm hoping that people will share the video with friends who might be struggling as well. Can you send us the PDF or your presentation here so that I can actually add it to our website for the mental health resources?
Oh, absolutely. I can send it to Michael or after.
Perfect. So we'll get that and the video up so that people can continue to use it and share it, as well as get the attendee list over to you guys so that the CEU credits can come through. Thank you to everyone who attended. We really appreciate you guys checking in with us.
And
Thank you, Molly.
Yay. I'm glad y'all
And
are
thank
here.
you, Michael.
Absolutely. And one other thing before we break off here is if anyone is ever interested. Oh, sure.
Yeah, here, I'm gonna let Michael scooch in.
Okay, cool. One other thing before we break, if anyone is ever interested in wanting to know more information about Austin Oaks Hospital or any clinical trainings, Molly is a great presenter that we have, but we also do presentations like this from our hospital level once a month. So if you're interested in wanting to know more info about that, shoot me an email. I can add you to our distribution list. And also just any questions that you may have in general that you may think of after the presentation, feel free to get in touch with myself or Molly and we can help you guys out with that. But again, thank you so much for having us. We really appreciate it.
Thank you guys for joining us.
Thanks, everybody.
Thank you.
Have a great day.
Thank you. You too. Bye-bye.